Hi, nice to see you again. How are you? Good? I'm very well, thank you. We met before when you came to undertake the patch test to determine if you were a good candidate for the tattoo removal treatment. And you were. So today you're here for the actual treatment. But before you meet the physician that will carry on the work, I would like to apply some topical local anesthetic on your face, as your skin resulted a bit sensitive to the laser. Nothing to worry about, but this will reduce pain and discomfort that you might experience during the treatment. Is that okay? Good. I'm going to apply now, and then you will meet the physician. Okay, let me wear the gloves. Let me apply it on your forehead. Okay. And on your left cheek. I don't want to go too close to your eye, but you have them in the eardrum tattoo. I need to try and cover them as much as I can. Okay, perfect. Nothing on the chin and your cheek. We'll leave it on for just a few minutes, and done. You'll be able to have the treatment. Okay, I'm going to cover your 3 areas with cling film to prevent drying. can now go to the waiting room. You'll be called by your physician. No problem at all. Thank you very much. See you later. Bye. Hello. Nice to meet you. I am your physician, and I will carry on your tattoo removal treatment today. How are you feeling? Good. I can see you had the local anesthetic applied on your face. How does it feel? Any burning sensation, tingly sensation? No, good. Perfect. I will be removing them right now. Let me take this off. Okay. Perfect. And the one on your forehead. When we spoke over the phone, I have given you some information about what we are going to do today. But I'm going more into that in a moment. I mentioned you some important things to avoid prior to this treatment. I have a list here, so I will ask you a few questions if it's okay with you. Perfect. Okay, so did you avoid tanning or sun exposure? Yes. Did you avoid applying fake tan? Yes. Did you avoid using any oil or moisturizer today? Yes. Great. Did you avoid using any makeup today? Yes. Great. Now let's talk about your tattoos. Where did you have them done? Yeah. Yes, that too. Okay. Okay. How long ago you had your latest tattoo? Was the tattoo made by an amateur or professional? Okay. Have you undergone any prior tattoo removal procedure? No. I will now explain to you a bit more in depth how the treatment works. Then I will evaluate your skin. We can move over there where the bed is. You can lie down and I'll be there in a second. Thank you. How do you feel? Are you comfortable there? Perfect. I will now explain you a little bit more in depth how the laser tattoo removal works. This is the machine I will be using. Laser works by targeting the pigment in the tattoo with the correct wavelength for maximum absorption. Each color requires a different wavelength to work effectively. The high power of the laser and short pulse duration shatters the ink into tiny particles, small enough to then feed into the bloodstream. Over the 8 weeks or more following the procedure, the white blood cells clear up the debris from the broken ink naturally through the body. This clears the way for the next layer underneath to be seen and hit by the laser. And it is repeated until the ink is fully clear. Smaller tattoos require fewer pulses and larger ones require more. In either case, the tattoo requires multiple visits for treatment. Typically, you will need 6 sessions. After each treatment, the tattoo should become lighter. Why does it take more than 1 session to remove a tattoo with a laser treatment? It takes more than 1 session to remove a tattoo because when you got your tattoo artist applied the ink in layers. Because laser breaks the ink pigment into smaller particles, it then takes some time between sessions for your body to flush out the ink. Your skin also needs time to heal. What are the different skin types? In laser treatments, we use the Fitzpatrick scale to select the skin types of the client. This is determined by the amount of melanin in the skin and the exposure to UV light, the ability to tan. Using the scale greatly helps in understanding the skin's ability to react with different wavelengths and allows us to create personalized treatment. The fairer the skin type, the less melanin, therefore the more laser light is reflected and not absorbed. Lower melanin levels greatly reduce the chance of side effects such as hypopigmentation, which is permanent skin lightening. This is why you should also be at your natural skin tone and not tan when undergoing laser. Will laser completely remove your tattoos? Each person tattoo removal process is different, but in general, yes, it will remove fully your tattoos. Some colors may be easier to remove than others. Black ink tattoos are generally easy to treat. Green, blue, and purple ink is very treatable. Typically, it is only suitable for Fitzpatrick 1 to 3, which is exactly the range of your skin tone. These tattoo inks aren't as deep into the skin as the black ink, so the ink goes much quicker than black. In terms of red, orange, and yellow ink, we can treat them. However, yellow is almost irremovable just because it's so light of a color it's barely able to be picked up on the laser. Again, red color is usually only suitable for Fitzpatrick 1 to 3, and that's because it's not safe to do on darker skin. It's too aggressive. Now, white ink is pretty much irremovable just because it doesn't have any color to it. Tattoo removal on white ink is unpredictable at best in some cases. White tattoos can also oxidate and become darker, grey, and at the point there is pretty much nothing we can do with it. I hope this explains a little bit more how the treatment works. Do you have any questions? No? Perfect. I will now examine your skin and then I will take a photo of them to record the results of your procedure. Okay, Let me have a look. You have 5 small tattoos on your forehead. One, two, three, four, 5. Yeah. And then you have one big and 4 small teardrops on your left side. Okay. Nothing on your chin. And one medium and 2 small on your right side. Okay, so the majority of your tattoos are black, except from the 4 teardrops that are blue. And the medium one on your right side that is colored, but it is completely treatable. Perfect. I'm going to take a picture. Look straight ahead. Perfect. Take another one. Closer. Perfect. Now we can begin the treatment. I'm going to put your hair back so they would interfere with the treatment. You will need to wear these protective glasses during all treatment. So let me put them on. Alright. Perfect. And I will also use my protective glasses. I'm going to turn off the light to make you feel more relaxed. Okay, we can start. Please let me know if you feel any discomfort at any time. Perfect. I'll start with your forehead. for done. Now I'm going to treat the one big and the four small teardrops on your left side. Done. How do you feel? Do you feel any pain? No. Excellent. Now I'm going to treat the medium one and the two small you have on your right side. Perfect. Done. Yes, pretty quick. Painless, so yeah, I'm glad. So you don't have to worry about the next sessions. They will all be like this. Perfect. I'm now going to apply some protective bandage. And for teardrops, we'll use one tiny. Just like this. Perfect. Now I will give you some information about the aftercare. Okay, so in terms of aftercare, immediately after the treatment, you can apply an ice pack to soothe the treated area for the first 3 days. Cover the area with a layer of antibiotic healing ointments. Keep it bandaged with sterilized gauze. Don't apply any other creams or makeup to the treated area within the first few days. You can remove the bandage after 3 days, but keep the area as clean and dry as possible. You may also apply Vaseline or hydrocortisone cream to moisturize the area as it heals. Vitamin E ointment is helpful too, as it helps restoring damaged skin cells. Once you remove the bandage, you can shower and wash the treated area, avoiding high pressure water. Clean the area gently with mild soap and pat dry. For optimal results, maintain the bandage for as long as possible to minimize friction and decrease the risk of scarring. Do not pick or pop blisters or scabs, as doing this can lead to scarring, pigmentation, or discoloration. In case of bleeding that extends beyond the bandage, maintain the gauze in position and regularly replace the bandage to mitigate the risk of infection. Should you have any concerns about potential infection, promptly contact the clinic for advice. You should wear sunblock, SPF 25+, anytime you go outside. Sun exposure is one of the worst things for the skin after laser. After the treated area has fully healed and the skin is no longer broken, gently apply bio oil twice daily with a light massage until the day before the next treatment. This promotes increased blood flow to the region, facilitating the faster removal of recently broken ink particles. If you observe any changes in skin color, you might need over-the-counter hydrocortisone 1% cream available at pharmacies. Apply twice daily for a 2-week period. For optimal results, avoid tanning between sessions, as this will prompt the need for an extra patch test. Refrain from applying fake tan to the treated area in the next 2 to 3 weeks leading up to the next session. On the day of the treatment, avoid using any oil or moisturizer, ensuring the skin remains free of any products. Keep your immune system strong between and after treatments. The stronger your immune system, the faster your skin heals. A healthy immune system helps your body repair the wound and fight off infection. There are a few key things you can about you?